Good afternoon and welcome to this ESHRE corporate session hosted by MedITEX IVF, a world-leading fertility software. Nice to meet you. I am Stefania Esposito and I am an embryologist at the San Raffaele Hospital. The San Raffaele Research Hospital is a highly specialized multidisciplinary medical center of world importance, which embodies the integrity of the treatment, clinical research, and teaching activities. Our fertility center welcomes every year over 1,000 of couples who are unable to have a child spontaneously. I have been working as embryologist since 7 years in different hospitals in Italy. Previously, I had an experience of 2 years in the UK as a researcher. I have been kindly invited by Mauro Pasquali, CEO of Ital Medical, to present the electronic health record development and the use of innovative information infrastructures to increase efficiency in laboratory and significantly improve patient care. Please find my disclosure available on the slide. I am a member of the ESHRE Association since 2015 and member of CRITEX, Italian Society of Embryology, Reproduction and Research, since 2017. I have been working as embryologist at the San Raffaele Hospital Fertility Center since almost 3 years in the seminology and embryology areas, covering PGT and egg donor cycles. And I am also a MedITEX customer and active user since 4 years, as I used MedITEX also in my previous experience as embryologist. So why digitalization in healthcare? Healthcare quality is enabled by the accessibility and effective use of the clinical data. Unfortunately, the high specialized nature of medicine and the ad hoc implementation of clinical information systems have led to the fragmentation of health information and medical care. This prevents health workers from making maximum use of the information available to them, affecting quality of care. From this arises the need to have computerized systems that guarantee the interaction between the various medical sectors and the correct data storage. In particular, in our sector, reproductive medicine, it is essential to have an overview of the couple given by all the specialists in that sector: gynecologists, andrologists, embryologists, midwives, researchers. Electronic medical records, EMR, and electronic health records, EHR, store medical records in computerized storage and are used by physicians to improve quality of care and contain costs. Whereas EMR is usually considered an internal organizational system, the EHR is defined as an inter-organizational system. Personal health records, PHR, are online systems used by patients and are designed for transparency of information and to enable patients to be better informed and engaged. The systems interact and may improve patient care. In its own domain, organizational and personal, each provides access and information to health professionals and patients. EHR and EMR use by clinicians has been shown to be valuable in medical care, and PHR has been shown to increase engagement, involvement, interest, awareness, and understanding among patients. If combined, the system may ease the therapeutic process, since all parties involved will be better informed. In addition, their integration could create massive databases that could be analyzed using big data methods and tools. Overall, physicians concur that EHR, EMR use can improve therapeutic outcome and medical care, as well as patient safety. However, most clinicians who do not adopt the system are concerned with productivity loss and the initial financial cost of setting up the system. An additional challenge for many providers is to create complete interoperability in the health sector, given the substantial differences in information annotation across systems. They also drew attention to the lack of standardized methods for the assessment of data quality. There is a lack of standardization and uniformity in the use of electronic systems. This should be the basic principle for use that facilitate the control of patient data. Now let's analyze the various records. EMR, the electronic medical record, is a longitudinal electronic record of patient health information generated by one or more encounters in a care delivery setting. EMR data are typically collected by the patient's health providers employed by a health maintenance organization that owns and operates the system. This system is designed to provide a comprehensive picture of the patient condition at all times. This is particularly beneficial as the healthcare system becomes more and more complex, since fields of expertise in medicine have narrowed and more specialists have involved in the therapeutic process. This underscores the importance of having computerized medical records and accessible to a range of medical professionals to improve patient care. EMRs can also improve physicians' productivity since they can access medical information before the patient-physician encounter and avoid misunderstanding due to underwriting. Though there is many advantages to this system, adoption rates are fairly low in community clinics that face a number of obstacles. EHRs were classified on the basis of the International Organization for Standardization definition. According to this definition, the EHR means a repository of patient data in digital form, stored and exchanged securely and accessible by multiple authorized users. It contains retrospective, concurrent, and prospective information, and its primary purpose is to support continuing, efficient, and quality integrating healthcare. To support healthcare and maintain its quality, healthcare providers need a cross-institutional and longitudinal compilation of patient medical data. However, there is a difference. Whereas the EMR stores institutional data, the EHR shares health information across providers. Thus, the EMR contains partial patient medical history, whereas the EHR is more complete in terms of data provided by physicians. Health organizations worldwide are implementing EHRs in the hope of improving their medical service, effectiveness and efficiency ties, and enable to sharing of data and information about patients' medical and health history. EHRs are electronic medical charts containing medical data and information about a patient that are maintained by patients themselves. Patients can access PHRs online and view test results, prescriptions, allergies, etc. These medical records can be managed by the individuals by adding medical history, personal information, or simply to monitor their health. PHR are a vital part of the care transition intervention where older patients are encouraged to participate more actively in the therapeutic process. In a patient-doctor interaction, PHRs may provide a patient with a shared language with the physician. More knowledgeable patients may experience hospital visits or doctor appointment as more positive. An additional feature of PHRs and as a patient-centered care policy is that patients can maximize their health benefits and organizing information logically and succinctly. The PHR is designed to alleviate burdens in illness by providing access to information and is helpful in maintaining wellness. It is clear that integrating health information from all three PHR, EMR, and EHR sources can benefit patient care providers and policymakers. This integration combines demographic, lifestyle, and behavioral data with health records, thus providing a comprehensive view as required in the concept of patient-centered care. Integrating data from these three sources can provide a comprehensive view of patients and their specific needs. Integrated data from EMR, EHR, and PHR can create huge databases that are suitable for big data analysis methods and tools. This type of data analysis has great promise for driving personalized care, as well as improving public health decision-making and health policy crafting. The challenge of interoperability of health data should also be dealt with to create databases that are coherent and suitable for policy crafting, PHR, EMR, and EHR integration. At the San Raffaele Hospital, our EMR for daily use is MedITEX. I have been using MedITEX for more than 4 years and therefore working in the field of assisted reproduction for 7 years. I have experienced the transition from paper to digital and all that it involved, which is why I'm pleased to share my practical experience on this topic. We all know how difficult it is to accept changes. The initial reaction of people to a change is often one of rejection, fear, or even anger, despite of the benefit being seen. And this also happened with MedITEX. MedITEX offers a digital version of the paper file, also contains medical and treatment history of all patients. By making a comparison between what was done before and the way in which information was stored and how we now use MedITEX, the strength of the digital system are naturally evident. First of all, the information was extremely fragmented. Several files containing different patient information were used. The patient medical history and the anamnesis were contained on a FileMaker, while all the stimulation and information related to the laboratory part were reported on the paper documents. For each different laboratory procedure, PGT, embryo freezing, etc., several dedicated databases were used in which the information relating to each couple was stored. Obviously, all this fragmentation led to obvious consequences. First of all, low efficiency. In fact, managing each activity separately and independently from the whole process implied that repeated information was recorded and redundant activities were carried out every time an operation was recorded on one of the used files. Secondly, errors. The described mechanism consisting in reporting each time the single operation on separate files led to increase the number of manual activities and therefore increased the probability of running into human errors. Then, difficult constellation. The information related to each patient was recording on several files and stored with different data settings. Therefore, to have a complete picture of the patient, it was necessary to consult all the files individually, crossing then the information to reconstruct the general picture. And obviously, waste time. What described above involved a waste of time, energy, and misused resources. Now, let's talk about strength of MedITEX. First of all, traceability. Traceability of operation. Any activity carried out in MedITEX remains traced even if it is cancelled. The date, the time, the user who performed it, and the information relating to it are traced in the log. Traceability of the individual gametes and embryos. By using MedITEX, I have all the cycles carried out by a couple and the fate of the individual oocyte under control. I can easily know how many eggs, embryos, or blastocysts the patient has frozen in which single cycle and see which banks they are stored in. Before using MedITEX, it was known how many eggs, embryos, or blastocysts the patient had frozen, but it was unknown which eggs they derived from. It was possible to retrieve the information only after a long and difficult manual consultation exposed to a human error risk. Then, password security. Not everyone can access to all levels of consultation. Each user must have permission to access MedITEX. In fact, the manager allows access to the server according to what is needed. Each staff member can consult MedITEX based on the permissions he has and the kind of activity he does. This mechanism is essential to ensure the security of the information contained. Before MedITEX, everyone could access all databases, and it often happened that they were tampered with, duplicated info, data were deleted, and recovering them took a lot of time and energy. Certain laboratory biomaterial data are registered in MedITEX upon arrival, recording the material code, the bench number, the expiration date, the date of arrival, and the quantity. As the material is consumed, the remaining stock quantity is updated by its salinity number. This is an easy way to keep the remaining stock under control, and above all, to track the medium bench number used for each carried out technique. Before MedITEX, all medium bench and laboratory materials data were recorded both on paper, documents, and on several files. This could lead us to make mistakes, wasting time and resources. And what about KPI tracking? MedITEX offers the possibility to collect data related to specific operation of our process in a standardized way. Hence, allows us to easily perform periodical KPI data tracking, allowing us to measure the performances of our activities. In this way, also offers the possibility to launch small analytic pilots focused in specific areas of our process, allowing us to identify areas for improvement. MedITEX is used in an integrated manner between gynecologist, biologist, embryologist, obstetrics, etc., allowing an overview of the couple and at all levels across the various specialist areas of expertise. This increases awareness of the operators and becomes a guarantee of trust for the patients. Without neglecting any area, the couple feels followed in a complete way. This increases the trust in starting or continuing a path that is psychologically difficult in itself. Basically, from what we have been saying so far, we can summarize that MedITEX fits with the daily workflow supporting the whole operative process. Provides access based on the permission ensuring data security, create the right type of data harvesting smart data by feeding raw data. This fosters analysis of KPIs to quickly identify shifts in performances, and is an essential tool in the administration of patient care and research. Thank you very much for your attention.